Bacteriophobia, also known as bacillophobia or microphobia, is the excessive or irrational fear of bacteria. This fear can manifest in a variety of ways, such as avoiding situations where one may come into contact with bacteria, excessive cleaning and sanitizing, or experiencing severe anxiety or panic attacks in the presence of bacteria or thoughts of bacteria. Bacteriophobia is a specific phobia, or an excessive and irrational fear of a specific object or situation. While a fear of germs and bacteria is a common fear among people, it becomes problematic when it interferes with daily life activities. People suffering from bacteriophobia may avoid public places, or refuse to shake hands, or have a very strict regimen for cleaning and sanitizing. The fear of bacteria is not entirely unfounded, as bacteria can cause serious illness and disease. However, it is important to understand that not all bacteria are harmful, and in fact, many are beneficial to our health. Our bodies are host to a variety of bacteria, known as the microbiome, which play important roles in digestion, immune function, and overall health. It is only when harmful bacteria are present in large numbers or in the wrong location that they can cause problems. The cause of bacteriophobia is not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. People who have a family history of anxiety or specific phobias may be more at risk of developing bacteriophobia. Additionally, past negative experiences with bacteria or infection, such as a severe illness or a traumatic event, may also play a role in the development of this fear. Some people develop bacteriophobia as a result of having had a bacterial infection in the past, like tuberculosis or salmonella. The memory of the severe symptoms associated with the infection could have left a lasting impression, leading to the development of an irrational fear of bacteria, while others may have learned their fear through observing the behavior of others, particularly parents who may be overprotective and overly cautious about hygiene. Symptoms of bacteriophobia can vary but generally include excessive fear and anxiety in the presence of bacteria or thoughts of bacteria, avoidance of situations where one may come into contact with bacteria, and excessive cleaning and sanitizing. These symptoms can greatly interfere with daily life activities, causing problems at work, school, and in personal relationships. People with bacteriophobia may avoid public restrooms or public transportation, or may have trouble going to a friend or family member's house. They may also avoid eating at restaurants or limit their food choices to only certain types of food that they consider safe to eat. The excessive cleaning and sanitizing seen in people with bacteriophobia can also lead to skin irritation and dryness, and even more serious health problems if chemicals are inhaled or ingested. This can further compound their fear and anxiety, as they may worry about their own health and well-being. People with bacteriophobia also may avoid taking showers, washing hands, and brushing teeth properly, leading to further health issues. Treatment for bacteriophobia typically includes cognitive behavioral therapy (CBT) and exposure therapy. CBT helps individuals learn to change the way they think about bacteria and their fear of it. Through exposure therapy, people with bacteriophobia are gradually exposed to their feared object or situation in a controlled and safe environment, allowing them to learn that their fears are unfounded. Conclusion: Bacteriophobia is a specific phobia characterized by excessive fear of bacteria. While it is common for people to have some fear of germs and bacteria, it becomes problematic when it interferes with daily life activities. The causes of bacteriophobia are not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. There are effective treatments available, such as cognitive behavioral therapy and exposure therapy, which can help individuals overcome their fear of bacteria and lead a normal life. During CBT, individuals will learn to recognize and change negative thoughts and behaviors associated with their fear of bacteria, and will gain a better understanding of the role of bacteria in the environment and in the body. Exposure therapy, on the other hand, will gradually expose individuals to their feared object or situation in a controlled and safe environment, allowing them to learn that their fears are unfounded. However, it is important to note that treatment may not be a one-time process, and some individuals may require ongoing therapy or support. Additionally, it is also important for individuals with bacteriophobia to maintain good hygiene and health practices, but in a balanced and reasonable way, avoiding excessive cleaning and sanitizing. It is also important for family, friends, and co-workers to be supportive of the person with bacteriophobia, and to understand that the fear is not a choice or something that can be easily controlled. Educating oneself on the topic of bacteriophobia and the effective treatment options can also be beneficial in supporting a loved one or friend who may be struggling with this fear. In conclusion, bacteriophobia is a specific phobia characterized by excessive fear of bacteria that can greatly interfere with daily life activities. However, effective treatments such as cognitive behavioral therapy and exposure therapy are available, and support from loved ones can greatly aid in overcoming this fear and leading a normal life.